on the case, Albert Kligman, who is a biologist and dermatologist at the University of Pennsylvania School of Medicine, conducted these experiments at Holmesburg Prison in Philadelphia, Pennsylvania, which is the largest jail facility in Philadelphia County. The experiments were conducted from 1951 to 1974. They were clinical non-therapeutic experiments, which are studies that test new medical treatments but don't provide that treatment to patients. The experiments were sponsored by the U.S. Army, the CIA, Dow Chemical Company, and Johnson & Johnson. Prisoners were paid small amounts of money and they were told the agents were harmless, which was not true. The experiments violated the Nuremberg Code of Ethics, which was established in 1947 and set guidelines for experiments done on humans. The song I chose that's playing is Skin Song by Bat for Lashes, and it represents what the prisoners had gone through with respect to their skin and their bodies, which were experimented on. So most of the prisoners have physical and emotional scars from the experiments done at Holmesburg. Inmates were infected with ringworm, warts, the herpes virus, and staph bacteria. And they were also tested with infectious agents, radioactive isotopes, which are used to get diagnostic information about the functions or treatments of a person's organs. They were tested with dioxin, which is an environmental pollutant. It's a highly toxic chemical that can damage the immune system and cause developmental problems or cancer. And they were tested with psychotropic drugs, which are drugs that affect mood and behavior. Once again, the prisoners were told that these experiments were harmless, but obviously some of these agents had side effects that they were not told about. Some side effects include illness, lesions, scars, skin discoloration, hallucinations, confusion, disorientation, and delirium. Some of the bacteria used in the experiments caused these side effects. Some subjects also suffered permanent memory loss and chronic irritability. Some short-term effects of the experiments at Holmesburg Prison were that some of the dermatology experiments led to the development of Retin-A, which is an anti-wrinkle cream. Further experiments led to the creation of Renova, which was created in 1996, and that's also a prescription anti-wrinkle cream. In 1961, the World Medical Association recommended that prisoners should no longer be used in medical experiments, but this was not implemented because it was opposed by American doctors. Some long-term effects included prisoners that were left with permanent side effects. The National Research Act of 1974 created the National Commission for the Protection of Human Subjects of Biomedical and Behavioral Research. The 1976 Department of Health, Education, and Welfare report condemned the use of prisoners in research involving human subjects. And as of 1971, federal funds can only be used for tests with minimal risks to inmates. Prisoners cannot be considered suitable candidates for any biomedical study. These federal regulations protect prisoners, but they also block them from participating in research that can possibly benefit them. And institutional review boards were implemented, and these IRBs review proposed research that involves human subjects. They check for compliance with ethical considerations, and they develop guidelines for informed consent. The impact on the profession, I want to be a health educator or community health worker, and this type of work relies on evidence-based practice. And any research that guides health promotion programs has to be approved by an IRB. It needs to take ethics into consideration, and it's important to get informed consent from clients. The society I chose was SOPHI. It's the Society for Public Health Education. It was founded in 1950, and it promotes healthy behaviors, healthy communities, healthy environments. It's devoted to health promotion and health education across various settings. The SOPHI Code of Ethics says that health educators must uphold the integrity and ethics of the profession as they make daily decisions. Guidelines for health educators include responsibility to the public, responsibility to the profession, responsibility to the employers, responsibility in the delivery of health education, responsibility in research and evaluation, and responsibility in professional preparation. These are my responses. Any questions?